Hi, my name is Darian, and this is my very first video, so welcome to my channel. Today I'm going to be talking about braces, specifically getting braces as an adult, and even more specifically, why I decided to go with dental extractions and braces instead of orthognathic surgery to correct my underbite. Quick disclaimer before I get started, I am in no way, shape, or form a doctor, orthodontist, or surgeon of any kind, so this is not meant to substitute for medical advice. This is just a recount of my own journey, and hopefully you'll be able to find something informative or useful for my own process that perhaps you're thinking about getting something like this done yourself. And honestly, the best thing I could recommend to you would just be to go and seek out a consultation from an orthodontist or orthodontists to get multiple opinions to see which treatment option would be best for you. Now, why did I decide to get braces as a 27-year-old adult? Let's see. Well, most people, when I tell them that I was going to get braces, assume that it's for cosmetic reasons, when actually that's not really the case. The reason I decided to go seek out a consultation to begin with was because I started to experience some jaw discomfort as I opened and closed my mouth. And I had a hunch that it was due to the discrepancy that existed between my upper and lower jaw. I'll get into that later. But so I went out and sought out an orthodontic consultation, and they presented me with a few treatment options. Now, in regards to my specific case, I have what is called a Class III Malocclusion, which in layman's terms is essentially an underbite, which means my lower jaw did not grow enough to meet my upper jaw did not grow enough to meet my lower jaw. So my lower teeth actually stick out a bit further than my upper teeth. And that is not the ideal scenario. In an ideal scenario, an ideal occlusion or bite as they call it, your upper teeth should be sitting in front of your lower teeth, and that's going to improve your functionality as you chew and as you just live your everyday life. So that's what I was diagnosed with, and to treat that, they presented me with two real scenarios that I could proceed down. Now, I'd actually gotten orthodontic consultations while I was in high school almost 10 years ago, and at the time, the only option that my orthodontist provided me to correct my underbite was to undergo orthognathic surgery, which at the time was just something I was not considering at all. I was not really interested in at all. And so I just assumed that there was no other option aside from the orthognathic surgery to correct the situation, and was content with living my life as currently presented. So when I went to my orthodontist over the summer, they presented me with two options to correct the underbite. The first would be a surgical option, the orthognathic surgery, which is essentially they would have to sever what is called my maxilla, my upper jaw, and move that in front of my lower teeth after my teeth had been aligned as they should be. So my gap here would close, all the crooked teeth would be evened out, and then once that occurs, they would surgically remove this maxilla here, my upper jaw, bring that forward, and then secure it into place, and that would correct my underbite scenario. The second option they presented me with was a dental extraction plus orthodontics and Invisalign method, which essentially involves them removing a teeth on both sides of my mouth. So if you can notice, I'm missing a teeth here and here. It's my first premolar. It's the first tooth after your canine. So those teeth are going to be removed at the beginning of the process, and then through braces, which I have on currently, they're going to bring the front 6 teeth backwards into sort of close that gap, and that's going to move those lower 6 teeth underneath my top teeth, and then everything else will be aligned with Invisalign. Now, it happens to be the case that my particular underbite is very minor, so my upper front teeth and my lower front teeth are actually touching in what is called traumatic bite. And I feel like that's almost a blessing in disguise, because what it actually means is that my underbite is not that severe. If my underbite was more severe and my teeth were even farther out, the only real option that would be available to me to correct my underbite would be to undergo orthognathic surgery. Given that my underbite is slight, my orthodontist felt that the issue could really be treated through a non-surgical approach, and that's with the dental extractions. So that was the reason why I had those two options. In the past, I've seen orthodontists who believe that the only option for me would be to undergo surgery. But now that I have this more new information, I began to consider that as the better alternative, especially because my orthodontic and surgical team actually recommended the non-surgical approach as the better option for me, given that slight underbite that I have. So in terms of the timeline of both of the options, let's talk about that a bit. So the surgical option would be a total of about 15 to 16 months, and that includes braces for the entire extent of the time. And then I believe at month 9 was when I would have been ready for surgery. So the surgery would occur then, the braces would stay on, and then I believe there's only like 5 or 6 months beyond that after surgery to have braces on, to have my teeth ideally aligned. So a total of 15 months, which in the grand scheme of things is a really short period of time. You know, when I had first thought about going to get braces, I assumed that this would be a multi-year process. So I was actually surprised to hear that it would only take about 15 months to complete. Now, in terms of the non-surgical dental extraction method, I believe that's going to take about 20 to 22 months total. And that involves the first 6 to 7 months are going to be with braces on the bottom teeth only, not on the top teeth. As you can tell, I have no braces on my top teeth, just on the bottom. So the first 6 to 7 months will be braces on my bottom teeth. Then the braces are going to actually come off, and they're going to put Invisalign on the top and bottom. And I believe at that 6 to 7 month mark is when the holes, the gaps between my teeth is supposed to be mostly fully closed. And I should also note that I got the dental extractions 2 weeks before I got the braces put on. So the teeth came out in the beginning of December, and then it was 2 weeks to heal, allow for the holes to heal. And then 2 weeks after getting the teeth out, I got the braces put on. So after the braces were put on, 6 to 7 months, braces come off, and then 11-ish months of Invisalign to get everything perfectly aligned to get that ideal result. With regard to my decision-making process, I was evaluating the two options I was presented based on the following criteria: how the procedures would impact my facial aesthetics or appearance. In other words, how my face would actually look once the treatment option was complete, how the procedures would affect the functionality of my jaw and teeth, or how the procedures will affect the mobility, stability, and comfortability of my mouth, and lastly, the overall cost of the two treatment options. So in terms of the functionality between the surgical and non-surgical result, how my mouth is actually going to function, they're both going to yield me that 100% ideal functionality result. So that's actually a huge plus, and that's more so what I was focused on as opposed to the aesthetic. Now, in terms of the aesthetic results, the surgical option, according to my orthodontist, will yield me that 100% ideal result, while the non-surgical option will yield me somewhere around 85 to 90% of the ideal result. What that actually looks like in terms of the way my face is going to look, I would never know, because I chose to go down one path, and I will never know what the other path would look like 100%. But apparently, the difference is so slight between the two options that my orthodontic team felt that it wouldn't be worth it to really undergo the process of having to do surgery, as well as the costs that will be incurred through that process. Now let's talk about the costs. For the surgical option, the cost for the orthodontics, meaning just for the braces, was a little over $7,500. Now that doesn't include the cost for surgery, which could be quite expensive depending on whether or not you have health insurance and whether your insurance would actually cover the procedure. To get the cost of the surgery, my surgical team would have had to submit a pre-authorization form to my health insurance company, which is typically only done when someone decides that they actually want to go through with surgery. Given that I opted to go with the non-surgical option, this form was never submitted, and therefore I never received a quote, for lack of better words, for the surgery itself. But given my specific health insurance plan, the most I would have had to pay would have been $2,500 out of pocket. The non-surgical options pricing was a bit more straightforward. The total for the orthodontics is about $6,700, and the extractions were only about $200 or so. So you can see that the non-surgical route was a bit more cost-effective overall. While I have dental insurance, my dental plan, my orthodontic plan, does not actually cover orthodontics for adults. So I actually did a bit of independent research and tried to look into some insurance companies that provided adult care, but the programs that I was able to come across, you had to be enrolled within the program for I think like a year before you were able to begin your treatment. So that would have set back my timeline another year, and it didn't really seem worth it to me, especially when you consider that I believe the insurance would only have covered about $1,500 total of the entire treatment. So that's still, it wouldn't have put a significant dent in the overall cost. And so it didn't really feel like it was worth waiting that period of time for me to only be able to take advantage of $1,500 or so reduced from my total. Now, for some people, your circumstances might be different. If you're a minor, or if you're 19, I believe some plans cover up to 19, you may be able to enroll in a program, or your parents' program perhaps, that covers your orthodontic care, in which case I would definitely encourage just doing your research in general. Even if you don't fall into that category, I would definitely do your own research and see if there are any orthodontic coverages that would be able to apply to your situation. So this is how my non-surgical payment plan actually breaks down. There was an initial down payment of $1,500 broken in 2 months, so $750 each month, and then a monthly payment of $200 over 25 months, with one payment at the end of $180 to bring you to that total of $6,680. So my thought process while deciding between the surgical and non-surgical option was that if the only real negative of the surgical option, aside from the cost, the higher cost, is that it would be a little bit more uncomfortable, that I would be willing to go through a little bit more discomfort in the short term if it meant that the result at the end would be more ideal, because ultimately this is the result you're going to live with for your entire life. So you want to make sure that however it is you look, you want to be comfortable with that. So ultimately though, after having consulted with my surgeon, my orthodontic team, they believe that the difference would be so tiny, so not even noticeable, that it really wouldn't even be worth it at the end. So ultimately, my orthodontist and surgeon both agreed that the best option for me would be the non-surgical result. Even though the surgery would get the 100% aesthetic result, the non-surgical option would get that 85 to 90%, and it would still achieve 100% of the functionality, which is what we're looking for. My bite would be the way it should be. All the teeth would be aligned. There wouldn't be any issue there. So all those things considered, it just didn't seem necessary to have to undergo the surgery, the cost with the surgery, the recovery time, and just that overall process, when the non-surgical route could yield me just about as good of a result as I would get with the surgical result. So once I felt 100% comfortable with my decision, I made my way on down to the surgeon's office to get my 2 teeth extracted and begin the process. And honestly, I couldn't be happier with both my surgical and orthodontic team. I have full trust in their ability and their plan for me, and I'm excited to see how it all plays out. So as I mentioned, I'm almost, today marks a month of being in braces. So I have about 6 or 7 months left, or 6 months, I guess, of braces. And then those are going to come off, and Invisalign will start from there, and then 11 months. And that's the process. It's pretty painless, pretty smooth so far. I get my stronger wires put on next month, the beginning of February. And so that's really going to start the shift in my teeth moving backwards and closing that space. So I'm excited. This is something that I've been thinking about for a long period of time. And so I'm just excited to be along this journey. And so I hope that my story has been helpful to you in any way. If you have any questions, feel free to leave a comment, or feel free to shoot me a message. I'd be happy to share more detail about my story. And I plan on putting out more videos semi-regularly detailing my journey and what it's been like, how I'm sort of experiencing the braces process, because I know it varies from person to person, but I'd be happy to share as much as I possibly can about my process, with the hopes that it could be helpful to you along your journey. So I hope you have a blessed day, and see you next time.